Hello, my name is Mandy Daly, and I'm a parent of a preterm infant. Today I'm going to talk to you about my journey with my daughter Amelia. This is Amelia Faith. She was born on the 8th of October 2006, and she was born at the end of week 25 of pregnancy. I had a placenta abruption. She was mechanically ventilated for 4 weeks, on CPAP for 6, and spent 3 months in a neonatal unit. So what did we know when Amelia came home from the neonatal unit? We knew she had bronchopulmonary dysplasia. We knew she was a slow feeder. We knew that her immune system was compromised, that she was at risk of developing retinopathy of prematurity. She had a hemangioma on her left foot, which is very common in preterm infants. She would be followed up for 2 years, and she would have caught up with her peers by age 2. So what was the reality for our family? Well, Amelia had bronchopulmonary dysplasia, and really on discharge, we had no idea what that would look like. And what it was her lungs were very poor. She had a lot of respiratory tract infections, and they continue actually 17 years later. What we didn't realize was that bronchopulmonary dysplasia is affected by infants' position when they're sleeping. So infants with BPD don't necessarily like sleeping on their backs. Amelia would often have trouble self-regulating herself to sleep, and when she did sleep, she would only sleep for 1 or 2 hours and would always wake up screaming. It took us about 9 or 10 months to realize that she was waking up in pain because of her BPD, because of her positioning, and we would have to sit up with her for the remainder of the night. The only position that she was actually comfortable sleeping in was sitting up. She still has BPD 17 years later. She still has a lot of chest infections and has ongoing issues with going to school and being absent. Because she wasn't getting a lot of sleep as an infant, it impacted her energy levels. And if she didn't have any energy, she didn't actually have enough energy to feed the next day. And if she wasn't feeding, she'd have no energy. So it was kind of a vicious circle in those early days. And feeding was really challenging. She was always a slow feeder, but even transitioning to solids was very, very difficult. She had no interest in food. She would spit everything out. As it transitioned, it turns out she was having an oral aversion, which went back to her being mechanically ventilated, and we didn't actually realize that. So as we were making her feed every day, we were actually compounding her oral aversion, and that is very challenging as a parent when you don't know something exists and you're following the rules to feed your child, and we were just making it worse. It took us a long time to have that diagnosed, but I suppose in hindsight now, it probably was very obvious from day one. She has never had any interest in food. She eats a very limited number of foods, is rarely hungry, and she's been just diagnosed with avoidant restrictive food intake disorder. And these children are just simply, they exist on very small amounts of food, very limited amounts of food. Amelia would only eat a lot of carbohydrates, white foods, soft foods. She does struggle with taking in foods into her mouth, which have a funny texture or which require a lot of chewing. She will only chew things in tiny amounts at the front of her mouth, and it's all related to her being on mechanical ventilation for so long. Because of her oral aversion, she also struggles taking medications, which is challenging when you have a child with complex medical needs. And it's also difficult when you're trying to explain that to medical professionals when you say my child is unable to take oral meds. And they're saying, well, she's 16, she's 17, but she still struggles to swallow. She simply just gags and vomits quite a bit. Her hemangioma has gotten worse over the years. It has caused her to lose some of her toes, and her toenails are all gone. Her foot is quite claw-like, and she wears special shoes, which is fine, except for her, it makes her stand out from her peers. And in school, she does a lot of having to explain herself. And we would have had many challenges in the school system as well, with schools insisting on certain footwear being worn. And because Amelia's feet didn't comply with that footwear, she would have been struggling in the school situation. She was getting into trouble for wearing non-school approved shoes. Amelia has sensory processing disorder. Again, something I hadn't heard about in those early days, and it took about 3 or 4 years for me to realize what it was. We have 8 senses. We have sight, hearing, touch, smell, taste, proprioception, vestibular, and interoception. So in terms of her sight, a lot of bright lights would always have irritated her from very, very early on. And again, if you can imagine, she was cared for in a neonatal unit with very bright lights, and her brain is developing. And everything that happens in the neonatal unit has an effect on the brain. The brain needs the womb to develop. And if we can't recreate that environment, chances are that the brain is going to develop pathways that are slightly different from babies who spend the last 3 months of their pregnancy in mom's womb. Amelia also would have reacted quite a lot to loud noises. She would tell me that they hurt her brain in terms of her sense of touch. She really didn't like wearing clothes. She hated the feel of clothes near her body, the texture of clothes. She doesn't wear socks and shoes. She likes things turned inside out. Um, and again, if you can imagine a parent who doesn't even have heard of sensory processing disorder trying to navigate this infant who has some very unusual habits and desires, it's difficult. Amelia's olfactory system is oversensitive, which means that she reacts in a way to smells that you and I would think are normal, and she reacts on off the scale. So she can smell things like tea, things like oranges and yogurts make her vomit at will, and she's unable to control herself. And if you can imagine in a school situation trying to explain that to teachers that if this smell is in the classroom, my daughter is going to throw up. A lot of people don't know what you're talking about. They've never heard of it. And for her, it's challenging. It means she has to navigate a world where there are lots of stimulations that she has to somehow manage. And in some instances, it's just impossible. Again, her smell and her taste are very much linked. She can tell me that things taste very different from what you and I might think they taste. It's just a heightened sense of taste, and she does not like food. She doesn't see food as a pleasure. It's something that has to be done to keep herself alive. The three senses that you're probably not familiar with are proprioception, vestibular, and interoception. So proprioception, again, I wouldn't have heard of it, is where we are in space. So when we walk, we don't have to look at our feet so we know where we're going. Our feet will just move. Our vestibular sense controls our balance, and interoception is an unusual one. It actually controls our internal senses. It tells us how we feel. So it tells us when we're hungry. It tells us when we used to use the bathroom. It tells us how our emotions are. And children like Amelia who have interoception challenges don't feel hunger. Now, the other end of the scale is if a child is eating frequently, they may also have interoception challenges. Again, Amelia would have no sense of being able to make a decision. She doesn't know how she's feeling a lot. She struggles with her emotions. When she becomes overwhelmed sensorily, she is unable to cope. So we have there's a range of symptoms that point towards interoception issues that Amelia would have had as a child. We didn't know what they were. But I guess over time as a parent, you end up going through a list of what could this possibly be. So, and she lives it every single day of her life. In terms of movement, we did notice when Amelia was in school that she needed to move regularly to regulate her concentration. So she struggles with her emotions. She can become overwhelmed very quickly, and she cannot concentrate unless her body is moving. And that's part of a sensory processing disorder. Unfortunately, when you try and explain sensory processing disorder to educators, they are unable to accommodate it in some respects, which is okay, but they don't understand why a child can't sit down and concentrate. Amelia's brain is wired differently. She needs to move, she needs to bounce. So a lot of the time, if she was sitting still in school all day, she would come home and she would spend hours bouncing on a trampoline. She'd be bouncing off balls, jumping around, tumbling, just to regulate her emotions and keep herself calm. We know that children who've been in the NICU for long periods of time experience a lot of painful procedures, sometimes up between 700 painful procedures for babies born under 28 weeks. That has a long-term effect. If we don't manage pain in our NICUs, the way these children perceive pain as they grow up will be very different. Amelia perceives pain in reverse. So if Amelia breaks an arm, she doesn't feel it. If Amelia falls and cuts her knee in school, it's as if she's been shot at close point range, which makes it very difficult to understand those or to see those situations when she may need to go to the emergency room because her perception of how she feels is very different. And this is quite common in preterm infants. Amelia's fine and gross motor skills are compromised, so she would have struggled a lot in the early days with her pincer grip, trying to dress herself. She wouldn't be able to do buttons or zips or hold a pencil in school. Her gross motor skills in the mornings as an infant, she would never be able to come downstairs. She simply couldn't navigate the stairs. She would have to sit in her bum and come down the stairs that way safely. And her brain would start to kick in around maybe 10, 11 o'clock. She went on to be diagnosed with developmental coordination disorder, which explains a lot of her inability to coordinate her own body. That compromises her ability to enjoy herself in school because when she participates in physical education, she's been compared to her peers, whose bar is much, much higher than hers. So her results in her physical education tend to be very poor, even though she's actually participated in every activity. She can't reach the bar that they're at, but she is participating. And I think there again is a different mindset with our educators. They don't understand things like dyspraxia and developmental coordination disorder, and all of our children are lumped into one pool when they're being judged. Amelia's executive function is quite poor. She really struggles with tasks. She's really struggles with understanding what the next plot in a line might be, what the next task in a sequence of tasks is meant to be. And that persists at age 17. It is hard for her to find strategies because her brain just simply isn't good at looking forward and wondering what the next step might be. She's had a lot of speech and language issues growing up, but she has been more or less rectified with speech and language therapy. But there are still some residuals that we have actually decided that she's done enough speech and language therapy, and it's probably, in the greater scheme of things, it's not the biggest challenge that she's going to meet. Given that she's had 17 years of health issues, being different from her counterparts, she does have a certain amount of generalized and health anxiety. She worries about her own health. She probably over worries about it. So when something small happens to her, she catastrophizes and she's not able to rationalize what that actually means in real time. And of course, we all have those future concerns. We know that research tells us that preterm infants have higher incidence of ischemic heart disease. They develop endocrine disorders much earlier. They have higher incidence of mental health issues. They reproduce less. They have respiratory and renal disorders into adulthood. And that's all in the very near future for Amelia. What is the impact then of prematurity? Well, we do know that awareness about prematurity and the consequences of prematurity is really lacking amongst our education community. And it's not their fault. It's just not something that's part of their curriculum. And we would like to see it embedded in their curriculum from outset so that early year and primary school teachers have a sense of those children in their class who may be presenting with a whole wide variety of behavioural, emotional, developmental issues that may be linked to their birth story. It's really important that we ask every single family, was your child full term or preterm? Because the pathways those children take are very, very different. We know there's an awareness among community-based healthcare professionals about preterm birth. So when I present in a community healthcare setting with Amelia when she was very young, and I'm talking about the symptoms I'm observing, but I don't have the words to describe the condition, it was very clear that neither did the healthcare community. They don't have sufficient education around long-term consequences of preterm birth for them to be able to manage these cases. And if you can't get a diagnosis, it's really hard to get an intervention in place. And it can take a long time to get a diagnosis for some of the more obscure conditions. And the longer we leave no intervention, the worse it's going to be and the more difficult it's going to be to be able to rectify it. And school attainment is going to be compromised. These kids are different. They stand out earlier. They don't have as many friends. They're challenged in things like mathematics. They struggle socially. If they have sensory processing disorder, a lot of their time is spent worrying about how the school uniform feels, why they can't concentrate because they can't move around. And as a result, their school attainment is less than their peers. And it does impact them socially. If you have an eating disorder and you want to go and eat with your friends for a birthday party, you're challenged. What can you eat? How are the smells going to be? So there's a lot of additional issues that preterm infants are faced with as they grow up. What is the reality like for other families? There are so many other side effects to preterm birth that we don't have in my family, but there are so many families out there who may have cerebral palsy, their two kids have autism spectrum disorder, they may have ADHD or ADD. There are lots of behavioural challenges and learning difficulties which we don't have, but do exist. Some of our children end up getting tracheal stenosis or vocal cord paralysis and requiring surgery in adulthood. A lot go on to develop COPD. There are lots of children out there with vision disorders and deafness, all because of their preterm birth. What do we need? We definitely need an improved public awareness around preterm birth. If the general public doesn't know what preterm birth is, how are we going to react to it appropriately? Preterm birth are not just babies who arrive early. They are babies who can have a complex spectrum of needs throughout their life. Families definitely need more education around the potential long-term effects of preterm birth. I did not know what was going to happen. I assumed, because I was told that Amelia would reach the same as her peers at age 2. That did not happen. And that carrot was dangled in front of me. And for some reason, I suppose maybe I chose not to look at the things that were happening to her, explore them until age 2. And then you realize they're not going away. They're actually getting worse. So I think families need to be told that there are a range of potential long-term effects that can happen. And what are the red flags? How can the families be the ones who are proactively looking for these red flags and seeking intervention in a timely fashion? And our health system definitely needs to acknowledge that the long-term effects of preterm birth are very real. The research is overwhelming. it does point to preterm birth being a lifetime condition, yet our health system doesn't have anything built into it to allow these children access care faster. We also have adult clinicians who don't know that preterm birth can be the cause of a lot of the conditions these people approach adult clinicians in their later life with, and that's really important. We need to shore up our health system such that, when families are transitioning home from the NICU, that it's a seamless transition, that going from a neonatal unit to community healthcare is seamless, that everybody is on the same page, everybody knows about preterm birth, what the consequences are, and that the care is not broken. Likewise, when children are transitioning to adult services, in my country, there is a very, very steep cliff that these children go up because there's no transition. And we are campaigning constantly to say these children just don't recover at age 18. They are preterm for life, and the conditions they have require monitoring for life. So therefore, our health system needs to take a step back and say, where are the gaps? What do we need to do to make sure that these transitions are seamless and that we provide a care for these individuals when they need it before a crisis happens? We need structured community-based follow-up. Families tell us after discharge from NICU or after discharge from around age 2, they struggle to find follow-up in the community. They struggle to have their voices heard. They recognise that their children have issues, but they don't know what they are, but they do know that they're different. And they struggle to get into care. They struggle to get a diagnosis. And then when they get a diagnosis, actually accessing intervention is very challenging. Overall, I think we need a subspecialty to facilitate lifelong follow-up for our cohort so that they can access the appropriate care and interventions when they need it to improve their long-term outcomes.